I think one of the really fascinating aspects of it specifically is that it more or less forms its own little new organ within an organ.
The cancer does.
Yes, the cancer does. And it has this mechanism of growth that's really quite undescribed. Nobody really knows how, in 3 dimensions, this cancer grows. When you take a section of it, look at cancers from people with renal cell carcinoma, they have a very stereotypical structure. They look like almost like normal cancer tissue, or normal kidney tissue, that's surrounded by this very intricate network of blood vessels. And so when we started looking at that, we started wondering if this developmental, if essentially organ development was going on here in this tumor. And so then we started looking with markers that we know are specific to embryonic kidney development, and asking specifically about blood vessel development, because we know that blood vessel development is absolutely essential to renal cell carcinoma formation. And the state-of-the-art treatment, pharmacological treatment, is blocking vessel signaling pathways. And so we started working with FOXD1, which is a transcription factor in a pathway that we know developmentally regulates blood vessel formation, and started to try to translate that to renal cell carcinoma. And we found that we have a very high correlation between FOXD1 expression in these tumors and the other aspects of vessel formation. So the tumors that express high levels of FOXD1 appear, or do in the sample size that we have right now, associate with a much higher level of vascularization. And so we want, with this grant, to understand what exactly FOXD1 is controlling. It's a transcription factor, so it just activates and inactivates certain parts of the genome. And so what we really want to know is if the FOXD1 transcription factor is controlling a set of genes that promote migration or proliferation of certain vascular cells. And we're primarily interested in pericytes, which is this support cell that lines the vessels.